Naknow, Virginia, Hedrick, Shregon, Mewamecha. Good morning. My name is Virginia. I'm a member of the Yurok tribe of Northern California, raised there on reservation. I currently live in Sacramento and am the executive director for the California Consortium for Urban Indian Health. We do statewide policy advocacy and public health programming on behalf of California's Indian Health Service funded urban Indian organizations in California's largest cities, including 2 residential treatment facilities. American Indians and Alaska Natives are incredibly vulnerable to a pandemic such as COVID-19, given we know the high risk categories for COVID-19 are those with pre-existing conditions like diabetes or heart disease or any respiratory diseases. And the CDC has consistently released data that shows that American Indian and Alaska Natives have large disparities in that we have diabetes 3 times, we're dying from diabetes 3 times that of the national average. We die from the seasonal flu at 4 times that of the national average. We data from the 1918 pandemic, the Spanish flu, there wasn't a lot of data collected there scientifically on race data, but early reports in that time showed that American Indians during that pandemic died at a rate as high as 4 times higher than the average American. So just looking at the data alone, we know that we're incredibly vulnerable. The CDC has not released national race data, but the state of California has began to release race data as it's reported. Unfortunately, reporting of race data for COVID-19 is coming along very slowly in the state. Under 70% of positive tests report race, and right in the ballpark of around 80% are reporting race for death. And so we can't really use those 2 numbers. It's really comparing apples and oranges to calculate a fatality rate or even a case fatality rate for American Indians in the state of California yet. That will be something that will come when we have better data available and more mandatory reporting of race when it comes to COVID-19. But we do know that we're an incredibly vulnerable population. California is home to the largest number of tribes in any state, with the exception of Alaska and Alaska Native corporations. And more than 90% of American Indians and Alaska Natives live in our urban areas and are often overlooked and not reached by general public messaging. There are so many things that we could talk about when we talk about how do we reach American Indians. One is culturally competent and culturally specific messaging. There is a historical distrust among American Indians to government systems, particularly when it comes to healthcare. These same healthcare systems that sterilized American Indian women without consent within the last 40 years here in the United States. And so when we have these same government entities issuing shelter in place, it can be really difficult for these communities to trust that. And so organizations like myself and other statewide tribally focused organizations are really trying to bring information in a good way around just how vulnerable we are to this infectious disease and why it's important to follow such guidance.